let's just cut every single tax bracket in the state of California in order to stimulate and grow the economy. Then let's create a rainy day fund with the surplus that's going to result, and then use that rainy day fund to deal with the volatility. And that doesn't require a constitutional convention, doesn't require changing the structure and it doesn't require new ballot initiatives. What I'm proposing can be done by the governor and the legislature, and that's why I've gone the route that I have. Yes.
Follow up to Ed's question, when that's tried at the national level, because the tax rates are progressive in the first place, the response is you're giving tax cuts to the rich. How do you win the rhetorical battle?
Right, and that's why I've decided my initial focus is going to be on just cutting every tax bracket, and I'm not proposing flattening. Like I said, philosophically, I just want everyone to know I support flattening and simplifying. But I think here politically, then the discussion would then go from cutting taxes to you're shifting the tax burden argument. It's a good argument to have philosophically, but I think it would end up slowing down what I really want to have happen, and that is I want every tax bracket to go down. I want every taxpayer to pay less. I want every small business and large business to have more incentives to keep more of their hard-earned profits. So my proposal avoids this whole debate for the time being. Let's fix our broken economy. Let's not debate about the shifting of the burdens, and let's just provide tax cuts for everybody. That I think, like I say, I think that has a much better chance of getting done.
How concerned are you that the healthcare legislation at a national level is going to have an impact on the budget here in California?
I'm very concerned about it. I got to say, I was much more intrigued with President Obama as a candidate when he was talking about healthcare reform than where he's going now. I mean, as a candidate, at least, President Obama zeroed in on the problem is with costs. Costs are getting out of control. It's now 15 or 16% of the entire economy and growing. We have to contain costs. Well, I agree with that. As insurance commissioner, I've noticed here in California, health insurance premiums doubled in the last 5 years. Costs are out of control. And I've been working hard to implement some cost containment mechanisms for the system. But now his cost containment plan is going to cost $1 trillion. I don't even see how that jives. It's nonsense. That's number one. Number two, the federal government, you want the federal government to get involved in our health care decisions? Gotta be kidding. Now, some things, I was in Washington, D.C., in the White House for a year. I appreciate what the federal government does in some respects. The military, national security issues, we count on the federal government for some of those things. But to set up another agency, like a FEMA or the post office or Amtrak to work on health care, it'd be a disaster. I completely oppose any move of any kind that somehow empowers people in Washington, D.C. That'd be a big mistake.
And what about the argument that there's not enough competition in the health insurance markets currently?
I agree with that.
Okay.
I totally oppose this public option as the means to solve that problem, because a public option means creating another federal agency. Big mistake. Alarm bells should go off. No. But I do want to stimulate more competition. Now, in California, there's been some mega mergers, and there's only a handful of health insurance companies left. Now, what I think would be a bold move to create more competition overnight would be to allow health insurance companies to sell across state lines. Right now, they're prohibited from doing that. You could have dozens of more competitors immediately, and that's a good thing. I got to tell you, I'm a big believer in competition. I mean, I'm not here to argue that big companies are solve all problems. I mean, in fact, when big companies become like an oligopoly or like a monopoly, then consumers don't get well served. Consumers need to have lots of choices, and the health insurance could use a lot more competition. And so
that's one of the most common sense approaches to that I've heard. And how come that argument isn't being made at the national level by anyone other than a pundit or two?
Because clearly the people who are in control right now in Washington are on an agenda to take profit-making companies out of the healthcare business. They just philosophically have a problem with companies making money in healthcare, and they want a single-payer system with the government running the whole thing. And that this public option is just one important bold step towards having one gigantic government program providing all of health care.
But why isn't the GOP trying to press the competition across state lines? Because
They should.
it makes sense.
Occasionally you hear it, from some folks.
I've heard it from Ann Coulter. I haven't heard it from anybody in the Republican Party.
Well, they should. I mean, they should. It's a really good counter to we need more competition, kind of thing. I think it wouldn't take much. It won't cost. First of all, it didn't cost anything. It doesn't cost taxpayers a dime, and overnight, more competition would be a great thing. Let me just mention one thing on cost containment. I am a big fan of a couple of things that could go a long way to trying to contain the spiraling costs. I mean, one is electronic medical records. Now, I'm passionate about privacy protection, just like in the banking system. When you use your ATM card anywhere in the world, you can tap into your banking records that way. But there needs to be privacy protection, encryption, all kinds of things. But right now, 90% of all health records are paper-based, at least here in California. And there's a huge amount of waste and redundancy and errors, billions of dollars of waste. We need the ability of having a record that the consumer controls. But when you go into an ER, not being able to get access to your healthcare records is just a disaster. Mistakes are made, tests are repeated. We need that. The other thing that I think is important are clinics. I've spent a lot of time in ERs as insurance commissioner. Yeah, there's some, like the ER, Highland Hospital, downtown Oakland. On a Saturday night, you should check out that ER. I mean, they're not gunshot wounds and a drug overdose. I mean, it's intense. But there's a lot of people in that ER that don't belong there. They haven't been shot. They have the flu or something. In fact, half the people that go into ERs don't really belong there. And it costs 5 times more to treat someone in an ER than in a clinic. I'm a big fan of this clinic. The clinics are emerging. It could potentially be transformational. Some clinics show up in Walmarts, right, where they actually post the prices. Wow, what a wild concept that is. And these clinics can deal with a lot of the routine care very cost effectively. Those are the things we should be working on. Gosh, it just makes me angry that President Obama has gotten off of focusing on the real problem, which is cost containment. Let's get our handle around all the waste that's in our healthcare system.
Okay.
What else? Anything else?